Hey guys, this is Dr. Today we look at the etiological agents. So we are looking at the etiological agents, and this is going to be of the cancers. So first is we'll be looking at the arsenic and arsenic compounds. So what is associated with arsenic is going to be the lung carcinoma. It is going to be the lung carcinoma as well as the skin carcinoma. Next we move on to the asbestosis. So asbestosis, what do we have? Asbestosis associated cancer includes, there is a lung, there is as well the esophagus, esophageum, next is the gastric and the colon carcinomas. Next is, there is also the mesothelioma. So all this associated with the asbestosis. Then we move on to the benzene. So in terms of benzene, what do we have in benzene? It is associated with the acute myeloid leukemia. So AML, let's write it down, acute myeloid leukemia. Next is we move on to the beryllium and the beryllium compounds. So beryllium, this beryllium is associated with the lung carcinoma. And then we also have cadmium. There is cadmium as well as the cadmium compounds. These are associated with the prostate carcinoma. Then comes the chromium compounds. So the chromium compounds, they are associated with the lung as well as the oropharyngeal carcinoma. Next, we look at the radon. Radon is, and as well as the decay products. So radon and the decay products, so they are associated with the lung carcinoma. And lastly, there is a vinyl chloride. There is presence of the vinyl chloride. So what is this associated with? So vinyl chloride is associated with the hepatic angiosarcoma. Hepatic angiosarcoma.